May I invite Dr. Amit Malik to share his thoughts on this milestone moment.
Thank you. I'll keep it brief. So good morning, everyone. It's a real privilege to welcome all of you here today. Let me begin by extending my thanks to Sir, Shri Dinesh Gunarao, and to Ma'am as well, for making time on a Monday morning to come here and grace the occasion. It's great for Amaha, but it's also great for mental health that you've really made time to come and talk to us today, this morning. I think I also want to warmly acknowledge all the senior clinicians here today and the members of the wider mental health community, right? People who've been working in mental health for decades now. Many of you spent decades building and improving and holding together this ecosystem, and we've just shown up now, right? In the last 10 years, we've just shown up. So we've done it with quiet rigor, done it with deep care and an unwavering belief in dignity, right? So you've laid the path for us to walk on, and for that, I'm very, very grateful, essentially. And we are here today not just as Amaha, but also part of a larger family, one that includes Children First, which is our child and adolescent mental health team, and India Mental Health Alliance, which we co-founded with the aim of strengthening and collaborating with the broader mental health community, right? So just to push for the cause of mental health. Across each of these efforts, our intention is the same: to coordinate to a future where every person across every age and background has access to care that is compassionate, continuous and grounded in evidence, because it's very, very important, as I was saying, to give the right care. I also want to express a deep gratitude to our investors and partners, many of whom are here today. Your belief in this mission, long before it was becoming real, has been a big source of support to us, so thank you very much. So when we started Amaha 9 years ago, we didn't set out to build just a hospital, right? We began with the question, what would it take to make mental health care in India more continuous, more integrated and more human, right? That question came from where we saw what we saw every day, right? We as clinicians, so I'm a psychiatrist, so as clinicians and as family members. So families, including my own, have struggled to find help when things got difficult. So juggling therapy in one place, psychiatry in another, and then going for admission somewhere else, at moments of deep vulnerability, it needs more support. So here in Bengaluru, we are fortunate to have NIMHANS already, as I was saying, and which has long set the benchmark for mental health care training and research in India. It's like a place of excellence. But we must also acknowledge that no single institution can do it all. There's so much to do. And for what complementary models of care we can evolve over time, where we can serve the need. It's a huge need. 200 million people in India need mental health support, basically. So that's the intention. This is the first step, hopefully, of building this hospital. And over the past year, we as Amaha have served 40,000 patients and families. Our clinical team is 200 plus people today, right? And our overall team is about 400 people across Bangalore, which is our largest team, and then Bombay and Delhi, right? So, but as we grow, one part of the care journey remained incomplete, and that has been completed today with the hospital. We've seen again and again that when someone needed more structured, round-the-clock support, when outpatient care simply wasn't enough, the options were few, and experience was often fragmented, uncertain, and distressing. And that is what got us here to build this hospital. We've tried to create a space that doesn't just deliver care, but reflects what care should feel like. The environment is calm, private, and thoughtfully designed. The clinical model is team-based and recovery-oriented, with psychiatrists, psychologists, nurses, and care coordinators working together every day. And because we believe recovery doesn't happen in isolation, it happens as a collaboration, a partnership with the family and the experts. And just as importantly, we've built this as part of a broader continuum, to inpatient care, to outpatient care, to online services across different stages of somebody's illness. Because it's not just a cross-section, it's a long journey, and this is a critical part of the journey that we've now completed, essentially. This is also very personal for me. Over the years, I've worked in the mental health services across India and in the UK, and I've helped design services and train teams, and I've been fortunate to see what good care can look like, right? And structured, evidence, multidisciplinary and personalized support can really have great outcomes. So be it in technology, be it in care coordination, we can really make a difference. So trying to bring all that stuff through this hospital, we have tried to bring some of those best global practices and innovation here to create a space that is not only clinically rigorous, but also forward-looking. A space that blends international standards with deep understanding of the Indian context, families and realities. And I say this not just as a clinician, I say this as a carer. I've waited outside hospital rooms, I have had to ask difficult questions and navigate broken systems over the years. I know what it feels like to be scared, uncertain and unseen. And that's why this place matters. It's our way of saying you are not alone and your care will not be an afterthought. To the entire Amaha team, a lot of you are here today, thank you. Many of you have carried this vision through uncertainty, challenge and delay. You've done it with purpose and integrity, and you've brought this hospital to life with your belief in what's possible. And I want to close by saying this, not just as a leader here, not just as a clinician, but also as a carer. Every admission here is someone's worst day. Every referral here is a sign of trust. Every treatment plan is a responsibility. What we are offering is not just care, it's the possibility of recovery. And it is our duty to approach that with humility, with vigilance, and with the highest standards of clinical integrity. And I believe in this team to live up to their promise. Thank you very much again for coming.